Good morning, everyone. Today we're going to be working one of the most important places to move, and that is one of the places we spend the most amount of time, and that is our chair in the seated position. Oftentimes people think, oh, I got to move. So they get up from that place that they spend 5 to 8 hours a day and walk and go move elsewhere. The place we want to do our movement the most is where we spend the most amount of time. And the reason for that is when we sit down, our nervous system is really efficient. It goes into autopilot mode. We sit like 15 minutes in, our body starts to stack all our joints and we get into this kind of rounded position. It's kind of like a lazy position, but it's actually really efficient because a body doesn't have to deal with balance and sway when it's in a stacked position. But you sit in that stacked position, everything's compressed through the spine for 5 to 8 hours a day. Getting up and walking and doing some movement away from your chair is not going to do a whole lot to remedy that compressed state. So what we want to do is we want to move more from that place that you spend time in. And the idea is every 30, 50 minutes while you're sitting down, have a little timer and do 1 to 5 minutes of movement in your chair to help awaken your nervous system, to bring it back into alert state, which then as soon as you're done, it's going to start going back into this compressed state. But the more often we feed movement into our chair, the less compression that we're going to have by the end of the day. And that adds up over the course of days, weeks, months, and years. So we're going to be doing movement in the chair. Let's get started. So we're going to start with our crocodile breath. So crocodile breath, I want to imagine that we're breathing like a crocodile, or kind of like we're inflating our abdomen or our abdominal wall like we're blowing up a balloon. We're going to make 2 big C shapes with our hands. We're going to place our hands below the rib cage and above the hip bone in that nice meaty section of the abdominal wall. The thumbs are going into the low back musculature. I want to feel a little bit of that, those muscles in the low back. Index fingers are wrapping around so that we can feel a little bit of the abdominal musculature. And the palms are pressing into the side so that we can feel that side body musculature. And we're going to take inhales in through the nose, exhales out through the mouth. And as we inhale through the nose, we want to fill up that abdominal wall and feel it pushing out in all directions into our hands, forward into the index fingers, back into the thumbs, and out through the sides. So we'll get a nice inhale breath in through the nose. On the exhale out through the mouth, we're drawing our navel up and in towards the spine. And with each inhale, we're seeing if we can slowly expand that balloon a little bit wider so that by the time we get to our 5th or 6th breath, we have the most inflated balloon we possibly can get. As you exhale, really draw that navel in. Each exhale, try to express more and more of that air and allow the hands to cinch down just a little bit in order to create more resistance so that you can feel that inhale breath pushing out and away into the hands. And start to notice the symmetry of how it feels on the left side compared to how it feels on the right side. Are you getting the same amount of expansion into that right hand as you are into the left hand? And do you feel it especially into the palms and into your thumbs in that low back? Can you feel that area move on that inhale breath? Once we get to our last breath, we can allow our hands to drop down to the side. And we're going to continue with the breath, but now we're going to get into some light pelvic tilts. So now on our inhale breath, allow that breath to move more into the belly. We're going to allow the pelvis to tilt forward so that we get a little bit of sway in the back. That belly's kind of opening up in front. On our exhale, we're drawing the navel up and in, and we're scooping the tailbone so that we get a little bit of this low back rounding. I want to make sure that we're not moving into pinch or pain. So notice, is it more tight, sensitive on your inhale, opening up that belly, getting the sway in your back, or do you feel that tightness, tension, or borderline pinch on the exhale? Again, I don't want to move into pinch or into pain. So if you have those, we have to shorten our range of motion to stay just below that level 3 discomfort. I want to stay in the level 1, level 2 on a scale of 0 to 10 of pain. 1 and 2 being slight discomfort. Good. We're going to continue with that breath. We're now going to move up into our shoulders. So we're bringing arms straight down, spreading the hands as wide as you can. I want to work on spread so wide that you feel a stretch within the palm area of the hand. And turn the palms up as much as you can towards the ceiling. I'm going to get back into my side. So from here, we're going to exhale as we shrug. We're going to spiral our thumbs down to the floor. Let the hands move to more in front and reach so that we get a little bit of this nice rounding into the upper back. And then as we inhale, we're shrugging again and spiraling those palms up to the ceiling and then reaching straight down. Feel those shoulder blades slide down the back. Exhale, shrug, spiral forward, nice reach. Again, I want to see if you can feel a nice stretch across that upper back. And then inhale as we spiral those palms up and reach down. See if you can feel a little bit of opening up through that upper chest. And continue to spiral palms up towards the ceiling. The more we spiral up as we're reaching down, the more we're going to feel that up through that upper chest. Same thing as we're reaching forward. Continue to spiral those thumbs down to the floor and more. Now I want to start bringing back the pelvic tilt, and I want to add it into what we're doing in the shoulders. So as we exhale, hold on, I got to sneeze. Maybe not. As we exhale, reaching forward, we're also scooping so that we can start to add that rounding of the low back with the upper back. As we inhale, we're letting that pelvis move forward, getting that sway in the back at the same time that we're opening up the chest, nice and tall in the spine. I want to see if we can feel a nice stretch across the upper back, all the way down into that lower back. Can you feel them together? You don't want to make sure that we're not moving into pain. All right, we're going to keep the palms spread and turned up. Now we're going to start working one side of the shoulders at a time, doing our bowls of soup work. So palms are spread and turned up towards the ceiling. And we're going to work right hand first. We're going to spiral that palm, thumb down to the floor. And really, we're turning as much as we can to see how far can we spin that long arm bone at the shoulder socket, and then opening it back up towards the ceiling, and then doing the same thing on the other side. Try to keep the elbows actively extended and the fingers spread as we're doing these spirals through the arm. And as you're doing so, kind of notice, how does it feel on that left shoulder compared to how does it feel on the right shoulder? Does one side feel a little clicky, grindy, clunky? If it's painful, then I want to back off and make sure we're not moving into a level 3 pain. Now, as we're doing this, we can start to kind of ratchet the arms up a little higher with each one, continuing to spiral one side and then to the other side. And we're going to slowly let the arms come up a little higher until we get to a point of either where arms are parallel, even with our shoulders, unless you have some kind of impingement pain in which you can't get this high, then we're going to stay below that level of pain wherever you feel comfortable in that shoulder. Once we get up to shoulder height or however high you can get to pain-free, we're going to start to let that shoulder blade round forward. As we spin that arm, let it spin and then start to round the shoulder so it starts to move our spine a little bit. As we open up, then we go to the other side. And with each one, we're seeing if we can get how much twist can we get, again, without pain. How does that feel through that left shoulder compared to the right shoulder? My left shoulder is a little tighter, a little clunkier. I don't have quite as much range of motion. That's fairly normal compared to my right shoulder. All right, now we're going to bring hands down and we're going to grab the bottom of our chair and create a little bit of downward traction. We're going to pull down. And I want to pull down and feel the shoulder blades moving down our back, like we're pulling them into our hips. And I want to keep the chest open. So I don't want to be rounded with my shoulders rounded forward. I want shoulders rounded back. One way to know that we got the shoulders rounded back is elbow pits. Elbow pits, if they're turned in, your shoulders are going to be rounded. If they're facing forward, that should bring the shoulder blades more down and back and open up that chest. So from here, we're going to do some light neck mobility. So I want to have a nice tall spine, and we're going to start by checking our blind spots. Slow exhale as we look over our right shoulder, nice and light to start with. Inhale as we come back to the center, and then nice slow exhale as we slowly look over our left shoulder. And as we go further, or as we go side to side, we can slowly start to squeeze into that end range. Again, I want to make sure we're not moving into pain or pinch or a stressful position. If you feel some light stretch, I want to move within the kind of juicy nature of that stretch. Again, nice exhale as you look over the right, inhale to center, and then exhale as you look over the left. And kind of notice, how does this feel on the right compared to the left? Are you able to look as far? Do you feel tighter in one direction? I got a little bit more tension going to my left than I do to my right. Again, that's relatively normal for my body. Good. We'll come back to center, and now we're going to do our light tilt and lift. So lightly tilting the ear towards one shoulder. This is not a heavy drop. I don't want to reach the ear down, just barely tilting. Then the opposite ear, we're lifting it up like you have a piece of string pulling you towards the ceiling, or like you're trying to touch the ceiling with that ear. Inhale as you go back to neutral. Exhale as we go to the other side. I want to make sure we're still holding on to the chair. As you lift that right ear, you can even add a little bit more downward pull through that right shoulder so that you feel the shoulder moving down at the same time you feel the ear lifting up, so that we have a little bit of traction going on in that kind of side space of the neck. Again, I want to keep this light, moving into light, juicy stretch, but not pushing into discomfort or pain. Again, notice how does this feel on the left side compared to the right side? Good. We'll come back to our neutral position, and the last one for the neck, we're going to do some shallow neck rolls. So we're going to start by dropping the chin down to the chest, but I don't want to make this, I don't want to go all the way down. I want to keep this kind of shallow to start with. From here, letting the right ear softly move to the right shoulder. Then we'll let our eyes look up to the ceiling. And then our left ear moves to the left shoulder, and then chin back down to chest. I want to make sure again that we are not moving into a painful position. And as we move through those 4 points, we can start to smooth them out and make them into more of a circle. And as you're feeling into it, as long as it is not painful, we can start to deepen our neck roll. We can start to let that chin drop a little closer to the chest as long as it doesn't hurt. Let the ear move a little closer to the shoulder. Again, eyes up to the ceiling, opposite side. Nice slow inhales in through the nose. Nice slow exhales out through the mouth. Again, I make sure that we are not moving into anything that's triggering over a level 3. Really, I kind of want to keep this below level 2 when working in the neck region. Once we get about 5, even up to 10 reps, we're now going to reverse direction, but we're going to reverse direction staying shallow again. I always want to start shallow, work to deep, because even if you do this every day, some days there's going to be a little something there that you're not ready for, and we can trigger some pain, cause some issues in the neck. So I want to think first, explore, make sure that the movement is safe. So chin to chest, left ear slowly moves to the left shoulder, eyes up to the ceiling, right ear to the right shoulder, and then chin back down to chest. And again, slowly smoothing those 4 points out into more of a circle and starting to get a little deeper into the movement as we feel comfortable. Notice if it feels different rolling your head in this direction compared to the other direction. Are you feeling some tightness and tension patterns that you weren't feeling in the other on the other side? I get a little bit more in this right side or left side neck, shoulder, especially as my head's rolling to the opposite direction. It wasn't there when I was going in the other direction quite as much. All right, we can let our hands loose from the chair. And now we're going to start getting into our hips. I'm going to bringing left ankle up to the left knee. I want to make sure the right foot is nice and solidly flat to the floor. If you feel imbalanced in the chair, it's okay to hold on to the chair a little bit for support. We're going to start with just doing some simple hip mobility, reaching that knee down to the floor lightly, and then lifting it up towards the ceiling, and then back down. As we're reaching down, I want to see if we can feel a little bit of mobility, maybe a little bit of stretch deep in that hip socket. May not be a heavy stretch unless the hip's really tight. And I want to make sure that this is not painful on the knee or on the hip. If you're feeling pain in the knee, especially as you reach that knee down, see if there's an area, if you can lift up higher so that you have some room to move down that doesn't take you into that painful position. If you can't do this without knee pain, this would be a movement that I would suggest taking a break on and then scheduling a consultation with me. Link is in the description below. Making sure that we're exhaling as we reach down, inhaling as we lift up, and we'll go ahead and switch feet and do the same thing on the other side. So real quick, something to pay attention to on this is notice how tight that hip is. Notice where that knee sits. So my left knee sits a little bit lower. When I come to the right side, I want to be able to compare. My right knee is a lot higher. I've had 5 surgeries on this knee. This hip is a little bit tight and restricted based on that surgery history. So these are an imbalance. I want to Kind of notice these imbalances one side to the other so that we can start to work on them. Same thing, nice exhale as we slowly reach that knee to the floor. Inhale as we lift it up to the ceiling. And how does it feel in that hip socket on this side? Does it feel different? Is it tighter? Is it more restricted? Maybe it's less tight. Maybe it feels a lot more mobile. Is it more sensitive and painful is a very big one. Again, that would be an indication for scheduling a consultation. I feel this a lot more on that downward reach through the knee on this side. Once we match our reps, we're going to switch back to that left leg. So I want to kind of lightly reach that knee to the floor so that we have a little bit of that tension at the hip, but not a ton, and definitely not painful. And now we're going to work on some forward folds. So nice inhale into that crocodile breath. Exhale, we're going to let our hands move over our shins like a waterfall, nice and comfortably. We're not going to reach super far. Want to make sure that this is not painful on the knee or on the hip. Inhale brings us back up to tall, open. We can even add those arm spirals in. Nice palms moving up as we get tall, and then thumbs moving down to the floor, inward spiral as we start to reach to the floor on the exhale. Inhale opens up nice and tall. Exhale, nice, slow forward fold. And with each one, we're seeing if we can get a little bit further into that fold without stress on the hip and the knee. Also, I want to make sure that our foot that's on the floor is flat and balanced, that we're not moving and rotating through that foot and getting into different positions. That way we keep the focus on this elevated hip. You can notice how it feels through that hip. Once we get about 5 to 10 reps, we can switch and do the same thing on the other side. So again, nice inhale as we get tall. Exhale, let those thumbs kind of spiral down so that we get that extra little rounding in the upper back as we cascade over the shins. Inhale as we bring it back to tall. Another area to kind of pay attention to is low back. Do you feel some tightness and tension in your low back that's greater when your right leg is up compared to your left leg? Again, those kind of things can be very helpful in kind of understanding the patterns that are going on in the body, especially if we're dealing with some pain, especially chronic pain. This side's much tighter on my right hip. I also feel it a little bit more in my right side low back than I did on the other side. And I even have a little bit of sensitivity in this knee, probably at a level 1 of pain, but it's a little sharp. That's not unusual for this knee. All right, bringing both feet down, and now we're going to change our position on the chair. So we're going to move into a split stance so that the back of the chair is on. Got the back of the chair to my left side. Just my left hip is on the chair. If you feel out of balance on the chair, it's okay to hold on to the back of that chair. We're going to let our back leg slide back as much as we can with the toes still tucked. I want to try to get to where this knee is directly under the hip and the hip is directly under the shoulder and the head. However, if you have significant hip tightness, you may find that you're not able to get quite there. So it's okay for that knee to be a little bit forward if that hip is significantly tight. We're going to work on this. The goal is to slowly get that hip to open up so that we can get more into this position. So first thing is I just want to assess the position. How can we get into the position? What does it look like? What does it feel like? Are you holding onto that back of the chair for dear life? Or can you kind of let go of it just a little bit. And then we're going to move and do the same thing on the other side. Again, sliding that back leg back. Toe is tucked underneath. Again, if you need to hold onto the chair, that is okay. How does this side feel compared to the other side? If you're finding this position is incredibly challenging, then a really simple little drill we can do is just simply moving back and forth, going from one position into the other position. Again, make sure if you need to hold onto the chair, you're staying safe. Breathe in through the nose, out through the mouth, and then moving into the other side. In through the nose, out through the mouth. Doing that 5 times on each side will help to slowly open up this position so that we can get to the next thing, which we'll do now. So again, I'm on my left side, left knee is forward, right knee is down and back. With that big toe tucked. Now, if you're having issues with the big toe being tucked, say the big toe is really tight or it's painful, then I'm okay with untucking it so that we can work on the hip. But ideally, we're able to get into this tucked position because that's going to work that hip a little bit more. We're going to come back into our crocodile breath, breathing into our belly, exhale, drawing that navel up and into the spine. And on our next inhale, as we inhale, that hip of the knee that's down to the floor, we're going to let that pelvis start to move forward so that we feel the belly open up and we get that sway in the back. And then on the exhale, as we draw that navel up and in, we're scooping that pelvis forward. I want you to imagine your sacrum is the palm of your hand, which would make your fingers your tailbone. So as you're scooping, you're trying to reach the fingers forward. You're trying to slide them forward like you're trying to touch something out in front. The more you are able to scoop, you're going to feel a good stretch through the front of the hip. Want to make sure we're not moving into pain. Nothing higher than a level 1 or a level 2 on a scale of 0 to 10. Once we get a good 5 up to 10 reps, we're going to do the same thing on the other side. So again, toe is tucked. If you're able to, nice inhale into the belly, exhale, draw the navel into the spine. On that next inhale, allow the pelvis to tilt. Feel a little bit of that sway in the back. Exhale, drawing navel in and scoop. Again, reaching that tailbone as far forward as you can. Feel it scoop and slide forward. You may feel a lot of like work going on in that back quad. Don't be surprised if from doing this work that you have a little bit of soreness in the legs. It's not unusual for this kind of work if it's the first time doing it. Things to kind of notice on this movement is, does the big toe feel tighter on the right side or the left side? Does the front of the hip feel tighter on the right side or left side? Do you feel it in your low back more on one side over the other? We're going to come back to our left side, getting into that same position. And we're doing the same inhale breath, pelvis tilts, exhale, navel to spine as we scoop. And we're going to add another layer into this movement. So as we inhale, feel that pelvis tilt forward. On the exhale, as you scoop, drawing navel in, I got my right knee down, so I'm taking the right hand and I'm reaching up like I'm trying to touch the ceiling. Inhale, I'm letting that arm soften a little bit as I fill up that belly, let the pelvis tilt. Exhale, drawing the navel in, scoop, and nice reach. And I want to feel that reach through the hand, lifting through the abdominal viscera. That scooped pelvis is going to have that stretch in that front of the hip. As I reach up, I want to feel that stretch getting moved up into the abdomen. Inhale, we let it soften. Exhale, feel that reach. Another thing I want to watch out for on this movement is I don't want to drop my opposite shoulder. I'm not trying to reach up by letting this shoulder drop down. This shoulder should stay at the same level. My right shoulder is reaching higher without dropping my left shoulder. And we'll do the same thing on the other side. So again, big toes tucked if you can. Nice inhale into the belly, exhale as we scoop, and then adding in that nice lift. Inhale as we let it soften, fill up that belly, exhale, drawing it in, scoop and lock in that back hip first. Continue to exhale as you lift fingers, feeling that stretch moving up into the abdominal viscera. How does it feel on this side? Again, if you need to hold onto the chair, that is okay. You might notice that you need to hold onto the chair more when you're on one side than you do on the other. And that's actually a really important factor to pay attention to. Again, worth bringing up in consultation, because that's going to be an imbalance in our posture. So it's definitely something we want to work on. Good. We're going to switch back to the other side again. Still playing in that same position. So back foot, toes tucked, knees directly under the hip. We're still doing the first part with our breath, allowing that pelvis to tilt forward. Exhale, scoop. But now we're going to add in some rotation. So as I exhale and scoop, I want to turn my chest towards the back of the chair. If your hand's already on the chair, you're just rotating your chest, seeing if you can bring your other hand to the chair. And if you can even add a little bit of pull, making sure it's not painful. Inhale as we bring it back to forward, allowing that pelvis to soften. Exhale, scoop, lock in that back hip first, and nice slow rotation. Notice how does this feel through the back, low back, hip. As we scoop, we're getting that stretch in the hip. As we rotate, that's going to bring that stretch more across the obliques. And then we'll compare that to how it feels on the other side. So again, toes tucked, knee under hip. Nice inhale into the belly, exhale, drawing navel up and in as we scoop, lock in that back hip, and then adding in nice rotation, really trying to keep that chest open. I don't want to reach with my shoulder. I want nice open chest. I'm turning that chest square as much as I can towards the back of the chair. Inhale, let everything soften, open up that belly, sway in the back. Exhale, scoop, drawing navel in, and then nice slow rotation. How does it feel on this side compared to how it felt on the other side? Is it tighter, more restricted? Do you feel it more in the hip, in the low back on this side or on the other side? Good. We're now going to come off the floor, off the chair, and we're going to get behind the chair. We can use the chair a little bit, or actually, I'm going to bring the chair more to the side. So now that we got some decent mobility in, I just want to work a little bit of standing and balance work. So we can use the chair as a balance support. If you need a little stability, you can also use a staff, couch, whatever is available. If you don't need the chair, then we can move it to the side and we can do this work with just balance. The less that we need support, the better. But if you need support, I want you to use that tool until we gain better stability. We're going to work on some balance clock work. So we're going to balance. I'm starting on the left leg. I want to spread the toes as wide as possible. We're going to come into a single leg balance. And I want to make sure that that foot is staying grounded to the floor. So I don't want that foot rolling back and forth. If it is, that's where we want to add that little bit of stability with the chair so that we can just find that point where we can keep that tripod nature of the foot. I want the ball of the big toe, ball of the pinky toe, and heel all touching the floor the whole time. If it starts to roll, it's going to be picking, you're going to be going bipod to bipod. You're not actually in a tripod. So if you can get into that position, I'm going to set the chair out so that I can try this without the chair. If you can maintain a grounded foot, then the next thing we're going to do is we're going to work kind of our 6 and 12 o'clock. Nice, slow reach forward, coming up to tall, and then nice, slow reach back and behind. Now, as I'm reaching, I want to extend the knee for as much as I can and point the toes and then reach. The more I actively extend that knee and reach the toes, the more active I'm going to be in the hips. Same thing, reaching behind. Extend the knee, point the toes, and then reach. Once we do 5, we can switch feet, doing the same thing on the other side. Now, real good assessment point is, this foot, are you able to be grounded on the tripod better or worse than you were on the other foot? Differences in one foot to the other are significant if you think about our gait mechanics. If one foot is a little less stable, it's going to be a greater risk of falling. So I want to, that makes this a really important drill to build up better balance and stability in both feet and ankles. So if we're able to be in that nice tripod, and I'm a little shaky on this right leg compared to the left leg. Extend the knee, point the toes, reaching forward. Inhale as we come to tall, extend the knees, point the toes as we reach back. Again, how does this side feel? Is it a little shakier? Is it a little wobblier? I got a little more wobble in my right knee than I did on the left side. Good. Once we've done 5 of those in each direction, we're coming back to the left leg. Nice balance. And now we're going to work 3 and 6 o'clock. Again, if you need the chair, probably easier to set it in front at this point. I'm going to move mine a little bit further out of the way. Still want to maintain that perfect tripod. Extending the knee, pointing the toe, and then seeing how far can we reach that toe. Inhale as we bring it back to tall. And then we're going to let that foot go behind, extend the knee and point the toe. And from there, we can see if we can reach a little further. And then can we get back up to tall? Again, if we need that point of balance and stability, I want to make sure that we have it. And then with each one, as long as we're maintaining that perfect tripod foot, we can slowly start to reach a little further. Again, making sure that extend the knee, point the toe. The more I'm extending the knee and pointing the toe, the more we're going to feel that work in the opposite hip, which is where we really want to feel it. Again, my left foot feels a little nice and stable today. Switching to the right foot, coming back up to that nice same balance point. Extend the knee, point the toes, nice slow reach. Inhale as we get back to tall, reaching behind. Ooh, that one's a little harder on this side. Extending the knee, pointing the toe, and nice slow reach. Again, how does this side feel compared to the other side? If one side feels weaker, less stable, more out of balance, then this would be a drill that I would recommend doing throughout the day, probably 2 or 3 times a day until we start to get a little bit better balance. All right, we'll bring the chair back out, come back into our seated position, and we're going to finish with some more crocodile breath. So making our nice big C shapes with our hands, thumbs in the back, index fingers in the front, hands below the ribs, above the hip bone. Nice slow inhale in through the nose. Nice slow exhale out through the mouth. And as you exhale, feel that belly button drawing up and in towards the spine. Let those hands kind of cinch in. So on your next inhale, we're inflating that balloon and feeling it expand, pushing out into our hands. With each breath, we're kind of breathing into tension. Kind of notice that tension in the shoulders. As we exhale, drawing the navel in, allow any tension in the shoulders to kind of soften and relax. After we get 5 or 6 breaths, we can let our hands down. We're going to continue with that same breath, but we can now kind of let that breath move up more into the ribs, into the chest, and up into the shoulders. Kind of again, breathing into tension. And then on that exhale, allow that tension to just rinse off the body like it's being washed off and just flaking off onto the floor. And when you're ready, make sure you're not dizzy or lightheaded after that breath work before you come up into a standing position.